Hi, Mindy Paulette, Health and Wellness Advisor with Henriott Group. I'm here today to provide you a quick introduction to one of our partners, Brian Schroeder, co-founder and CEO of Preventia Group. So we're just going to dig right in, right? So just tell us who and what is Preventia?
So really what Preventia is the way I like to talk about it is the first ever lifestyle care and behavioral health marketplace. Yeah.
So where did the idea come from?
So the idea really comes from working, in the trenches and doing this work. I've spent 20 years in healthcare, and most recently I got to live at this sort of interesting intersection of both wellness and healthcare. And it was my job to work within my health system to really pull those things together with the other teams that were, actively participating and doing the same thing. And we stood up this new model of lifestyle medicine a couple of years back, and we got statistically significant outcomes immediately. And it's not that we were surprised by that, but we were kind of surprised by that. We knew that it worked, but it worked very, very well.
Tell us a little bit about what does it look like from the user's side experience? What are the
For
options?
them? So basically, the way the entire application would work is first we look within the data, right? And you mentioned that earlier, how important that is. And we work really hard to either provide a broad application or implementation where you're looking at kind of a preventive model. And maybe you're doing 4 visits a year just to keep people in check. But really, it's looking within the data to define that appropriate population. And once you do that, you build your engagement and communication strategies around that to get the messaging out that these services are available at all. And then once you do that, you facilitate the connection to the employee and the provider. And once you facilitate that connection and give them a platform to do so, the visits would occur through the platform via telehealth. So it's just like FaceTime or anything else, totally HIPAA secure and locked down, but knowing that you have the confidence to, especially in this new environment, Mindy, this COVID world that we're living in, where the risk of venturing out right now to see a health coach or a dietitian or somebody that can help you manage your lifestyle is quite risky, or at least the perceived risk is high. So it makes it a lot easier to be able to participate right in the palm of your hand on your phone, in a native mobile-based application or, on an iPad, the same way you might connect with your parents or your extended family that you can't see right now. Provide them with a means to do that on your own time and terms, and that's kind of what we need right now.
Yeah, and I think you make some good important points because as we move forward, I mean, we're probably not going to get back into this face-to-face environment that quickly, and it's going to be a while, and you're set up to really accommodate that. So I think that's good to kind of help build continuity and also to as well an easy platform to introduce. Well, thank you so much for your time today, and I hope this gives everyone an introduction into what it is that you do. And I'm certainly Brian and I would be happy to sit down with any employer that might be interested in learning a little bit more and working together. So Brian, what's the best way for people to get in touch with you?
I say the best way, so there on our website, which is at preventiagroup.com, there is a way to submit requests for demos. Follow me on LinkedIn. I'm very active on LinkedIn. I love to engage with people on that platform. It's just a very simple and easy way to connect with me or with my team. I'd say either of those channels would be good.
Perfect. And you can reach me on LinkedIn as well, or Paulette, Paulet @henriott.com. So thanks again, everyone. We'll see you later.